Delaware's Lieutenant Governor is leading an initiative to fight the opioid crisis, and pets saved from hurricanes available for adoption. This is the Delaware Way. Welcome to the Delaware Way. I'm Larry Menti. We are proud today to be joined by the Lieutenant Governor of the state of Delaware, Bethany Hall-Long. Thank you so much for being here.
Thanks for having me.
There is so much to talk to you about, but we are taping this just 2 days after the mass shooting in Las Vegas, and I just wanted to get your thoughts.
You know, what a tragic situation. I know, and the two hats that I wear, both as our Lieutenant Governor as well as a university professor of nursing who actually teaches disaster preparedness. You know, we're never ready for such a tragedy, and it just goes to the core of why in America we need to have in place solid gun laws, as well as why we need to have the wraparound services and preparation. And I think we're seeing the good of people on the flip side, the first responders, the persons there, and it's such a tragedy.
I don't want to get into the gun law debate this close to it happening, but I do want to talk about mental health.
Yes.
There is nothing to say right now that this man had mental health problems, except for the fact that he went into a hotel and killed over 500 people. That is something that you're able to deal with. That is something where you're able to help people and prevent these things from happening. That we know.
Right.
But how do you pinpoint people if they don't show signs?
You know, it's very difficult, and I think in that one particular situation, we're going to see a lot of forensics and analyses and trying to figure out exactly what was going on with this person. Obviously, you have to have some mental health issue to go and cold kill individuals like he did. But the good thing is we have the ability, whether it's from violence of any nature, to begin to provide services and to start early. And whether it's a senior with undiagnosed mental health or a young adult, it's really paramount that we are there to provide early screening and treatment and assessment. And so that's one of the reasons why I was so excited to come on the show today, to kind of hopefully have an opportunity to share with you some of the great things we're doing in Delaware.
Right, I was just about to say, it was actually, you're the right person at the right time to come in and talk about this, because you are now chairing a behavioral health effort in the state.
Yes.
But first, tell us what behavioral health is.
Well, you know, behavioral health is a more recent term that is being utilized. Years ago, we heard people talk a lot about mental health disorders or disease, substance abuse. Behavioral health is the big umbrella term, and it is a term that I like because it includes the ability to have preventative measures, to educate before there is violence, to assist persons who maybe are suffering from a mental health disorder but suffer with a stigma. There's a stigma around a mental health diagnosis. And also when you hear the word addict or substance abuser, it's not always in a positive term. And so when we talk behavioral health, we're encompassing all the things, both good and bad, the gaps in services and things that we can do to help an individual. I
don't want to leave out anything because I understand every one of them individually, teen suicide, depression, they're all important issues. But we just had Dr. Ratay in here, who I know you're working with.
Yes, we are.
And she was talking about the opioid crisis in the state of Delaware. And the fact that across the country, so many resources are going into this, so much attention is being paid to it, and it's not getting better. It seems like the death rate keeps going up. What are we missing?
Well, you know, one of the reasons Governor Carney and myself and others and Dr. Walker and Dr. Ratay, as well as other cabinet secretaries, have come together to say, you know, what can we do to address this public health epidemic? You know, with 308 deaths last year in Delaware just with heroin alone, and we can't keep doing the same thing. And if we go back 20 years ago in Delaware, we had a similar issue, not a brain disease, not mental health, not addiction, but a disease called cancer. And we still continue to have cancer in our state. But at that time, Governor Minner appointed a consortium to begin to move the needle to lower the death rates with cancer. We are taking a similar model that we know works and getting the brightest and best in our state together statewide on a consortium to look at what can we do in the short term to address the opioid and heroin addiction problem, but take it further You know, it's much more. And why it hasn't been resolved? Because we're not always getting to the core issues. And the core issues are things like undiagnosed mental health issues, or something along a different avenue, economics and jobs, good paying jobs, social issues. So with the Cancer Consortium, we actually moved from being the second and the highest in death rates to midway down in the states. We lowered disparities among African Americans in colorectal cancer. And so we are convinced getting parents, individuals affected by substance abuse, and families and providers together, leaving their own biases behind, coming to the table with the right frame of mind, all kind of in the sandbox, playing together, that we're going to set clear goals. And our idea is with this behavioral health consortium that we will take statewide, and hopefully your viewing audience will participate. We will have forums up and down the state, and we want to really go to the core issues to say, what do we need? Is it more people on the street with community workers? Do we need more education and prevention in schools?
And the last time you were here, I asked you what your role was going to be as Lieutenant Governor, and you told me what you hoped it would be. You had not really had a conversation with the governor at that point. Is this it? Is this what it's going to be?
One of the major issues right here. The governor, as you know, had an action plan, and in that action plan, really important items, whether from our state's economic front to education reform to working in the city with Family Cabinet Council. And I'll certainly be working at those levels. But the number one issue right now is our public health epidemic. And he charged me to lead this consortium. So the Behavioral Health Consortium is something that we're excited to launch. Actually, at the end of the month, we'll be holding our first meeting. And certainly, indeed, that is an area I think you're going to hear a lot more about, and I look forward to champion.
Yeah, there's no more important issue. I would think, though, that you would be valuable to him as well, since he's been down in Washington and before that in Newcastle County in helping to work with the Senate and the state and the legislature.
Right, and having those relationships, as you know, is very important. Having been a member of the House, a member of the Senate, and being able to come together in a bipartisan fashion. It's appropriate that we're here on the Delaware Way. You know, we hear about the Delaware Way, and where people put aside party and differences to really make a difference in the issue of behavioral health, mental health, you know, prison reform, and all the things that we need to do to make sure we have social balance in our community, and that while we improve the health of Delaware, you improve the economic health. So if your physical health, your mental health is improved, you really do improve also the state's economy, and it all goes hand in hand.
Well, I'm glad you're on this. As I said, there's no more important issue. I really appreciate you being here.
Thank
you so much. Lieutenant Governor Bethany Hall-Long. When we come back, a friend of yours, I would imagine, Senator Stephanie Hansen, when the Delaware Way continues.